along those lines, Gabby, how about impact? So, a lot of us go into healthcare. Certainly if we were good at math, we never would have gone into one-on-one healthcare, right? Like, yeah, no investment banker would ever let you do that. But we do because we like people inherently. We like helping people and we like making an impact on our community. What was the impact you were hoping to have when you started your practice? Like, did you say, I'm going to positively change my area for this, or I'm going to help those people who aren't, are underserved? Was there kind of a mission or an impact you were looking to have?
Yeah, there was. And it was working with, Medicare and Medicaid who are very vulnerable and underserved. And especially Medicare, there's not a lot of therapists who specialize in geriatrics. It's actually I don't know what the stats are for social work, but I know for psychologists, it's less than 1%. So people do not like to work with older adults.
What?
Yes.
What is it a financial thing? They're just like, I don't want to work for that little bit of money. Like, why? Just roll the dice and you end up with 8 to 10%, right? Like randomly. And I can't believe that.
Yeah. I think it's the stigma that people think that it's depressing, that older adults are difficult. They don't want to change. Those are the things that I heard. And that's why we had so many clients, because other therapists would call me and would say, this client is not a good fit for therapy and I cannot stand them. They'd probably do really good with you. And they were right. So there's definitely a lot of stigma around working with that population. And I felt like they were underserved. They were vulnerable. Nobody was working with them. And I decided to take that on.
All right. Very cool. And so the impact was you wanted to help those geriatric folks in your area and that you came across.
Yeah.
When you look at the burned out days, were you having impact? Were you working with that same population? Had you given up and worked with anybody? Was the impact keeping you going?
It was keeping me going. I think that I feel guilty for not being as present as I have been.
Yeah.
I will say I was a little surprised that I didn't always come across that way. I know when I started tapering down my caseload because I knew I needed to. And then after I sold, I was still helping with the transition. And so I stayed for a year and I got my caseload down even lower. And when I was ending with people, it's just really surprising because I was thinking a lot of these times, I'm just sitting here listening to you. And it's a good reminder, we say in our field, that the relationship is 80% of therapy, not the quality that you use or the intervention, but it's really the relationship. And
sure,
that proved it because all of them actually were crying and were saying how impactful I was and how helpful it was to have me there to talk to week after week.
You're I've been like a stuffed animal in the room. You could talk. I'm not doing anything, yeah.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by TrustDrivenCare. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust-Driven Care. If you're ready to streamline your practice, check out TrustDrivenCare.com and see what's possible. Trust-Driven Insights. Real conversations. Smarter care. Stronger business.